Hello and welcome to the online open days for the preparatory and master program in rehabilitation sciences. Thank you for showing an interest in our program. We hope we can give you some more information on what our program has to offer in this brief presentation today. Before diving into the program, we would first like to present our faculty and part of our campus that hosts the program. The Faculty of Movement and Rehabilitation Sciences, or FABR in short, is a relatively young faculty focusing on a broad range of disciplines within movement and sports sciences and rehabilitation sciences and physiotherapy. Of the 2,800 students we have in total, the majority are female and enrolled in our bachelor and master programs in rehabilitation sciences. We offer many options for Dutch and English taught programs on the undergraduate and postgraduate level. The Faculty of Movement and Rehabilitation Sciences focuses on educational programs, while our research activities are clustered into the research departments. The Department of Rehabilitation Sciences is comprised of 4 research groups that altogether host 25 professors and about 75 ongoing PhDs. Our campus is located on the green outskirts of Leuven. Many of the infrastructure is oriented towards sport and elite athletes. Aside from boasting excellent facilities for hosting classes and practical physiotherapy sessions, it is also a very stimulating environment for winding down and participating in one of the many activities the university offers. We have a full virtual tour of the campus available online via the YouTube link at the bottom of this page. Next up, we will be discussing the program in detail. The preparatory and master program in rehabilitation sciences and physiotherapy is very unique on an international scale. It is one of the only physiotherapy programs globally that offers a postgraduate degree where evidence-based practice is combined with an additional specialization in a specific field of rehabilitation. The master's program is jointly taught by all of the 5 Flemish universities in Belgium, and as a result, students are able to learn from the best specialists each university has to offer. All of this knowledge is combined into a preceding half-year preparatory program and a 2-year master's program, which we will now tell you more about. The preparatory program is specifically designed for students who have already obtained a previous degree in physiotherapy or rehabilitation and who wish to further specialize in one of the majors of the master's degree. Through this one-semester program, your knowledge of all of the major fields of rehabilitation sciences will be refreshed. The preparatory program starts in the 2nd semester of the academic year, that is in February, and runs until June. Upon successful completion of the program, and at least 4 out of 6 courses below, you will automatically be granted entry into the Master of Science, starting in September. Note that prior knowledge of Dutch before enrolling into the program is not needed, but it is welcomed. An introductory level 1 course is included in the preparatory program. What is important to note is that the preparatory program is not intended for students of backgrounds other than physiotherapy or rehabilitation. If you have not completed a degree in physiotherapy, we recommend that you do so first before applying to the preparatory program and master. As mentioned before, the master program itself starts in September, that is the 1st semester of each year, with an automatic admission granted to all students that have completed the preparatory program. All students must enroll for and complete the preparatory program before being allowed into the master, and no exceptions will be given. Once you start the MSc, you will have the option to choose from 6 different types of majors: musculoskeletal disorders, and in that specialization, manual therapy or sports physiotherapy, neurological disorders, pediatrics, mental health care, or internal disorders. Upon successful completion of the master's program, you will be given the title of General Practitioner of Physiotherapy, meaning that you are able to work anywhere as a physiotherapist and in a specialized environment at the same time. When we look at the master's program in detail, we see that the first master year focuses on general courses, which all specializations will have in common, a general clinical placement, which you can be exempted for based on your background, the first part of your master's thesis, a minimum of 1 additional course to be chosen from a broad range of topics, and finally, the first courses specific to your major. The second year is when you will focus mostly on 3 aspects: the finishing of your master's thesis, a deepening of your knowledge in the major of your choosing, and finally, a minimum of 8 weeks full-time internship in a clinical setting. In total, the The master's program will take 120 credits and 2 years of full-time study to complete. Remember that the half-year preparatory program that precedes the Master of Science is also mandatory. We will now go over each of the specializations briefly. The musculoskeletal major offers you the additional opportunity to further specialize in manual therapy or sports physical therapy. The manual specialization focuses on the treatment of patients with spinal, upper and lower quadrant musculoskeletal disorders. On the right, you can see all of the major specific courses included in this option. On the other hand, the sports physical therapy major focuses on the treatment of athletes and related pathologies. Many of our graduates go on to work in sports federations, do specific work with elite athletes, or start their own private practice. On this slide, you can see all of the courses included in this major. The neurological disorders major focuses on the treatment of adults with typical neurological pathologies such as Parkinson's, MS, head injuries, etc. Most graduates go on to work in university hospitals, specialized rehabilitation centers, and private practices. On the left-hand side, you can see all of the courses featured in this major. The pediatrics major offers the option to specialize in pathologies specific to children and young adults up until 18 years of age. This is a broad specialization where the knowledge of neurological disorders and other fields of rehabilitation are combined. Graduates go on to work as independent therapists or in private practices, in specific centers or in special education. On the right-hand side, you can see all of the courses featured in this major. The mental health care major is quite unique. It is one of the only specializations in the world devoted to mental health problems and mental disorders in rehabilitation sciences. Graduates go on to be employed in a large variety of clinical settings: psychiatric hospitals, special education schools, psychotherapeutic centers, etc. No specific knowledge of mental health care is required before starting this major, besides graduating from a bachelor's in physiotherapy. Although most students who opt for this specialization have a clear motivation to pursue this particular major. The final option is the internal disorders major, focusing on a large array of pathologies in the cardiovascular and respiratory domain, but also on critical illness, for example in an ICU, metabolic disorders and cancers. Graduates often go on to work in university hospitals, rehabilitation centers, or are connected to a fitness center. Next up, we will be discussing how you can apply for the program, what the admission requirements are, and how much tuition fee amounts to. In terms of language proficiency, we require that all applicants are fluent in English before starting the program. You can do this by taking the IELTS, TOEFL, or Cambridge proficiency tests and passing the level required. You will be exempted from this if you have obtained a secondary school diploma or bachelor's degree from an English-taught institution in an Anglo-Saxon country. As mentioned before, prior knowledge of Dutch is not required, although it is welcomed. An introduction to Dutch is included in the preparatory program. A higher knowledge of Dutch is, however, strongly advised before starting the clinical internship in the second master year. Applicants are required to have obtained a previous bachelor's degree in physiotherapy or rehabilitation, generally being between 3 and 4 years in length. We require everyone to have a broad knowledge in all of the major fields of physiotherapy. If you have obtained a degree other than physiotherapy, for example biomedical sciences or biology, unfortunately we cannot admit you. The preparatory program and master's program are only meant for students already in the field of physiotherapy that want to further specialize. Aside from this, applicants should also aim to have good knowledge of statistics. Good academic merit is recommended, and we value that candidates tailor their motivational letter to the program. For the next intake of February 2022, applications can be sent in until October 1st, 2021. When it comes to tuition fee, there are two categories depending on your status. If you are a student from the European Economic Area, the total tuition fee for taking up 60 credits in one academic year amounts to €947. Students from outside of the European Economic Area pay €3,500 unless they come from a country that is categorized as a least developed country on the DAC list by the United Nations. Please note that the tuition fee is liable to change each academic year. Finally, We'd like to tell you a little bit more about the coordinators of each specialization and their specific expertise. Professor Geert Verheijden is the coordinator of the adult neuro rehabilitation major. Professor Verheiden's expertise lies, among others, in sensory-motor and functional outcome and recovery after stroke. The musculoskeletal rehabilitation major is coordinated by Professor Simon Brumagne, who is also the program coordinator of the master's program. His expertise lies in proprioceptive control of movement and posture in patients with low back pain. The pediatrics major is coordinated by Professor Kate de Slovere. Her expertise lies in general neurological pediatrics. The rehabilitation and mental health care major is coordinated by Professor Davy van Kampvoort, who is also the head of the Psychomotor Rehabilitation Research Group. His expertise lies in psychopathological disorders and general rehabilitation in mental illness. Last but not least, the internal disorders major is coordinated by Professor Thierry Troosters. He is also the head of the Research Department of Rehabilitation Sciences at KU Leuven, and he is the president of the European Respiratory Society. His expertise lies in peripheral and respiratory disorders, muscle and lung function, exercise tolerance, etc. This concludes the end of our presentation. At this point, we'd like to invite everyone to use the chat function to ask us any questions about the program that you may still have. You can also reach us after this presentation by using the faculty's help desk via the link displayed on this page. Also, do check out our faculty website where more information is available. Thank you for your attention.